Hey, my name is Buck Parker. I am a board certified general surgeon, and in this little video, I want to talk about the gallbladder and the problems that the gallbladder causes. Don't mind the unmade bed back there. This is just a call room that somebody slept in last night. Anyway, so a lot of patients have gallbladder disease and they need a gallbladder surgery, but they don't know what exactly that means, what the gallbladder does, why they need surgery, why they're having the problem, all that stuff. So I want to go over that in this video. So a little anatomy lesson first, okay? So let me get a little closer. Here we go. Now, not to scale, this is the liver, the esophagus, stomach, first part of the small bowel. This is the gallbladder, and these are what we call the bile tubes, or the bile ducts, okay? So liver makes bile all the time, and it trickles down these tubes here. There's actually a little valve right there before it goes into the small bowel. That valve is closed most of the time, well, when you're not eating, okay? And then the bile will back up into the tubes, and it will drop into the gallbladder, okay? The gallbladder then stores and concentrates the bile for when you do eat. It squeezes like a little muscular bag, like squeezes the bile out. The valve opens, the bile goes into the small bowel. It mixes with the food that was in your stomach, and it helps you digest your food, mostly the fatty portions of the food, okay? The pancreas now lives right here, and this is a little pancreatic duct, which sometimes meets with the bile duct. And every once in a while, you can have the gall stones, which I'm going to show you in a little bit, can cause pancreatitis or inflammation of the pancreas, okay? So I'm going to draw the little gall stones in here. And so what happens is the gallbladder concentrates the bile, okay? Sometimes it concentrates so much that it becomes a solid, and the solids turn into stones, and then you have these little stones here. Now what happens is when the gallbladder then squeezes, it shoots the stone out, and they can get stuck, okay? And they can get stuck anywhere along this little thing here. They can get stuck here, which we call the gallbladder neck, the common bile duct or the main bile duct, here anywhere along the main bile duct, and they often get stuck at the little valve, the little sphincter there. They can get stuck right there. Okay, so when they get stuck in there, then the gallbladder squeezes to try and shoot the stone out, and that's when you have pain. Okay, so people get they say, oh my God, they get a lot of pain right up in here. They go, oh my God, I'm having a lot of pain. Maybe sometimes right under the breastbone there, mostly in the right upper quadrant, what we call, and then sometimes it radiates around to the back. Okay, so that's the pain that gallbladder causes. So what we do for that, okay, is we just take this gallbladder out. So, okay, so all this portion, we take the whole thing out, and how we do that is most of the time is laparoscopically. And these days, you can see this little thing here. There's the belly button, the rib cage, and say the groin crease, okay? And what we do is make a little incision, which is about 1.5 millimeters, or 1.5 centimeters, sorry. And I'm going to show you this in a second. So we make an incision here, okay, 1.5 centimeters, 5 millimeters here, 5 millimeters here, 5 millimeters here. This is the right side, this is the left side, okay? And this is the belly button, right above the belly button. We put a camera in here, okay, and the gallbladder lives up here somewhere. Gallbladder lives up there. And then we put small instruments in. Okay, we put this is my awesome drawing for small instruments right there, like this. We get the gallbladder, we remove it, okay, put it in a little baggie, and take it out through your belly button. So that's that's what's called laparoscopic cholecystectomy, and that's what you'll get if you have a gallbladder problem with the stones. Now, there's lots of different problems that can happen with a gallbladder. Some of them include infection, and some of them do not include infection. So there's like a continuum. Okay, on one side you have basically the stones. They you form the stones, and they get stuck every once in a while. You have some pain, but then the completely goes away. That's called biliary colic, and that can cause you problems, can cause you a lot of pain, or it can cause you a minor amount of pain. Some people actually think it's gas pain that comes back again and again. That's pretty common, and that can just go away on its own. About 20% of the population in the United States have gallstones, and only about 20% of those patients that have gallstones need a gallbladder surgery. So not everybody, just because you have gallstones doesn't mean you have to have laparoscopic cholecystectomy. Okay, now on the way through to the continuum, over here is some pain every once in a while. Stone gets stuck, then it goes away. And we have over here where the stone gets stuck, it stays stuck, you have lots of pain, the gallbladder swells up so bad because the stone is stuck, and you get an infection, and you have sepsis and all that good stuff. In the middle is most of the people. So a lot of people just have biliary colic. They have a little bit of pain. They may come to the hospital for that pain. The pain goes away. Usually, if it's severe enough, we recommend that you have your gallbladder out. Most of the time, you should probably have it out, because once it happens one time, it's probably going to happen again. And you can have complications from that, which is pancreatitis, which is one of them. Can be a serious complication. The other complication from just gallstones is having an infection. So that's where we start moving along the continuum. So if we have the gallstone gets stuck long enough, then you can develop an infection in the gallbladder, and then you have what we call acute cholecystitis. So we have biliary colic and acute cholecystitis. The biliary colic actually can happen over and over and over a lot of years, maybe a little infection here and there. It's not that big of a deal. It goes away on its own. That will something we call chronic cholecystitis. So it's not really infected with bacteria, and you have fevers and chills and all that good stuff, but it's over and over. You have this kind of chronic process going on. So we have biliary colic, chronic cholecystitis, and then acute cholecystitis. If you have acute cholecystitis, then you're going to need antibiotics to take care of the infection, and then you'll need the gallbladder out as soon as possible. And then if we keep going on that continuum, we have what we call gangrenous cholecystitis, which is where the gallbladder starts to die, okay? And you can imagine if any of your organs start to die, that's bad news. So that's when you get really sick, you have the gallbladder starts to die, you need infection, and you need emergent surgery for that. So that's kind of our continuum of gallbladder disease. So the post-operative course for kind of a routine laparoscopic cholecystectomy or laparoscopic removal of the gallbladder would be generally you stay in the hospital. Actually, some folks do it as an outpatient basis. So you come in the morning, you have the surgery, then you go home in the afternoon. That would be for biliary colic or maybe a chronic cholecystitis that is not actively causing you problems. The acute cholecystitis, generally we see patients that come in, they have some pain, maybe their white blood cell count is up, which is a measure of infection, they have fevers, we give them antibiotics, we do the operation as soon as we can, and generally those folks stay in the hospital for about 24 to 48 hours, depending on their pain and all that. Or their post-op course. Some patients need a little bit more time because of the anesthesia causes some nausea and vomiting. Sometimes the pain is a little bit more in those folks, and so they may stay a little bit longer. But generally, I would say on the average, it's about 24 hours in the hospital. After the surgery, when you can go back to work or school and all that good stuff, it depends with the person and the surgery and the disease. So biliary colic, you probably can go back to work, maybe get it done on Friday and go back to work on a Monday. Acute cholecystitis, you may not be able to do that. You may have to wait maybe 5 days or a week even, depending on how you feel. So that's the general, give you a good idea of kind of your post-op recovery. With the incisions that you get, you shouldn't lift anything more than about 20 pounds for around 2 to 4 weeks, depending on who you are and what you do. If you are a smoker or you have what we call like maybe some poor nutrition, then you don't heal as well, and you should probably wait a little longer, about 4 weeks. If you are somebody that works lifting heavy objects all day, every day, you shouldn't do that. You shouldn't go back to work. Even if you're in good health, you should be lifting those things for about 4 weeks. Now, if it's just, you lift your kids every once in a while, they may be 20 pounds or something like that, then you can start doing that, in maybe a week or so after the surgery. So I hope that cleared some things up for you. A lot of people ask me about, a lot of people end up getting their gallbladder out or having somebody tell them they need their gallbladder out, but they don't know what it is and why they're getting it out and what the gallbladder does and all that. One other thing a lot of people ask is, does this change my diet? Do I have to do anything different after this and that? The answer is no, not really. Most people have some diarrhea after the surgery, but that generally clears up in about a week to 2 weeks. Very rarely it can last longer, as in months, like 6 months or something like that. That doesn't happen very often, but it does happen every once in a while. But as far as changing your diet after, you really don't have to change your diet. Now, the reason most people get this in the United States is because of their diet in the first place. In the United States, it's mostly due to cholesterol. The stones in the gallbladder are cholesterol stones, and that's because we like to eat pizza and French fries and hamburgers and all the good stuff, and those cause an imbalance in the bile. There's more cholesterol in the bile, not necessarily the blood. So if you have normal cholesterol in the blood and you have gallstones, that can happen. But the cholesterol in the bile itself ends up being more, the concentration in the bile of the cholesterol is higher than it should be. That's why you have the stone. So most of the time in the United States, it's because we like pizza too much. so if you want to avoid that, maybe you avoid the pizza, but people really don't like avoiding pizza. Anyway, that's my spiel on the gallbladder. I hope that helps you out a little bit, explain some things. You know where to find me at drbuckparker.com. I'll see you later.